Hello everyone, welcome to our Myopia Control talk of the day. Remember, myopia is the medical term for nearsightedness. Today we will be talking about some of the common questions that you as a parent might have when your child becomes nearsighted. And we have a very special guest joining us today, Dr. Iris Shen. Hello, how are you?
Pretty good, thank you.
Good,
Hello,
yes.
everyone.
Hello, everyone. Hello. And so, Dr. Shen, would you like to say a few words about this topic today, myopia or nearsightedness?
Yeah, sure. Practicing as an optometrist, nowadays we face a lot of kids getting diagnosed to have nearsightedness, which is myopia.
All right, Dr. Shen, so what does a parent need to know when they're told for the very first time that their child is nearsighted?
I think there are a couple of things that they need to know. The first is that their kids will be needing glasses to correct their vision so that they can see in class, then they can learn efficiently, because 80% of the learning are based on visual signals, so that's very important for them to see everything clearly, for them to study, to learn. And the second thing is nearsightedness can get worse over time as they grow, because that's when we get nearsightedness, we're talking about the elongation of the eyeball. As the kids grow, their eyeballs may keep getting longer and longer. So when you see your kids getting needs bigger clothes or pants, shoes, that also means they may need like a new pair of glasses, because their eyes can get worse over time. Third thing is they may not just facing to get new glasses or thicker glasses when they have a stronger prescription. There's also potential health risks related to nearsightedness. Like I said before, with the eyeball elongation, it's like when you're blowing a balloon. When the balloon gets bigger over time, then it gets thinner, right? And then there will be stretching to the structure. Then there will be higher chance, same as our eyeball. With the stretching, then it's gonna alter the structure of our eyeball. Then the kids may be facing higher risk for eye disease, such as glaucoma, cataract, macular degeneration, retinal detachment when they grow older, especially when they start aging. We may not see the changes like right now when they're young, but we need to pay attention to those risks later. The higher prescription they have, the longer eyeball they have, and the higher the risk they may have. And another thing is to bring them to your eye doctor for regular follow-ups, to monitor the change of their prescription, and also monitor the health of their eyes.
Wow, interesting, Dr. Shen, that you use the analogy of a balloon. So does it mean that when the child has high enough of a prescription, high enough nearsightedness, their eye will get so inflated that there's a risk of the eyeball popping?
No, no. Probably I didn't use the perfect description there.
But actually, no, I think that's a very valid analogy, because when things get stretched so thin, the eye doesn't pop per se, but essentially it's easier for it to develop holes and tears. So in a sense, the eyeball is not popping, but it is still thinning so much to the point that they can develop breakages in the lining called the retina inside the eye. So in a sense, it's still an appropriate analogy.
Exactly. And the retina is actually like if our eyeball is a camera, the retina is a film of the camera. So that's very essential for us to see. Imagine a film with a broken film, or like without a film, like when people have retinal detachment, that it no longer function anymore. And the retina is, it's formed with nerve cells. We all know nerve cells, they never regenerate. If they're done, they're done, right? That's why we want to keep an eye on the health part to make sure we catch up everything like early enough. And also, you mentioned that when the eyeball elongates and it gets thinner, once it gets thinner, then we may be facing retinal breaks. And also, there's another important layer underneath the retina. It's called choroid. The choroid actually is the layer provide blood supply to our retina, and it's very common to see a lot of times when we do a cross-section scan for the back of the eye for the patient, and it's very easy and fast for us to tell, okay, this eye belongs to a patient who has a high prescription. How do we tell that? Because then we see a very thin layer of the choroid. Then the blood supply of the it's not just the stretching, the mechanical stretching. It's also the blood supply has been affected to the retina, and which affects the health of the retina. That it leads to disease such as macular degeneration.
Yes, we all hear about macular degeneration. It can be a scary thing because it damages the central vision, right?
Yes.
What is one top way or top strategy to help kids slow down this nearsightedness once they do get nearsighted? Would you like to tell us a little bit about that?
Yeah, there are different ways to control the progression rate of the progression of myopia. One of the most common and popular treatment is orthokeratology.
Ortho-K, right?
Yes, short form ortho-K.
Or OK lens, or some people may call it AOK lens, or even dream lens. They have many different names, but essentially it refers to this special type of lens, right?
Yes. It's a type of lens. It's a type of rigid contact lens which can reshape the corneal curvature during sleep. So today we covered about ortho-K.
Yes.
And then we'll definitely we'll try to deliver more information about other options that we have.
Yep. Sounds good. So definitely stay tuned if you want to hear more about how to help your kid who's becoming nearsighted or whatnot, learn about other options or other solutions to prevent things from worsening. So stay tuned, and if you like what you're hearing, or if you have any ideas on what questions you might have in mind, feel free to comment and subscribe below. All right, thank you for joining us today, Dr. Shen. It was a pleasure speaking to you.
Thank you.
Good. Until next time.